change the way you age. Yes, you heard me. You can change the way you age, and I'm going to teach you how. I'm Dr. Tracy Page, and I will help you feel better, live healthier, look better, and improve your cognitive function. We will look at functional, cellular, and regenerative medicine, and I will teach you how to change the way you age. Let's get started on today's topic. I wanted to welcome back my listeners. Today, again, I'm very fortunate, as are you, to have Leonard Pastrana here with us, and he is from New Bio Age. It's a wellness network. He is a pharmacist. Today, we're going to talk about a topic that comes up a lot in my practice, especially with my female patients, but also my male patients, and that is hair loss. And so Leonard has a protocol that they have put together for patients to help with hair loss. And I use this in combination with a actual procedure, a platelet-rich plasma procedure that we can do as well. So I'm going to open up the mic, I should say, to Leonard, and we're going to talk about some pre-treatment as well as some maintenance treatment that patients can do and listeners can learn about when it comes to hair loss. So, hey, Leonard, thanks for being here.
Thanks for having me again.
Yeah. So you're a wealth of information. And so I would like for you, let's start with the pre-treatment, because I anticipate there'll be some patients that fall into this group. So let's talk about pre-treatment for hair loss and what can patients do when it comes to peptides and helping maximize their ability to grow hair.
Sure. Yeah. Like most of the protocols that we've talked about, it's, like this full pronged approach when we're dealing anything with, we've talked about weight loss, we've talked about brain function, and it's the same thing with hair loss, is that we want to take care of everything. And what we found is that if we can really improve the immune system prior to any of these hair loss protocols, we've seen that we've had much more beneficial effects. And so something that we've been utilizing or we've seen benefits from is a pre-treatment of thymosin alpha-1. That's obviously, we know that's going to be for the immune system, but more importantly, TB4, thymosin beta-4, that's had success with hair growth, and specifically with it increasing the stem cells, hair follicle stem cells. So it's almost like preparing the follicle for all the other treatments that we're going to do with what you do with PRP and with some of the other solutions that we do for maintenance therapy when it comes to hair growth.
Yeah. And so actually, I did a injection workshop with the SSRP. And in anticipation of us going over this, I actually was looking back. And one of the things that they had talked about was they add the GHK-CU or TB4 that you were just talking about, thymosin beta-4, in with the PRP when they do the procedure. So I know you and I were just talking about that can be very helpful. So not only can you use it for pre-treatment, but the thymosin beta-4, they actually used it during the PRP treatment as well. So yeah, I was just looking back at that. So two different ways.
It makes a lot of sense because it not only increases the hair follicle stem cells, but it also helps speed up the rate of growth. That being the TB4, and the GHK-CU improves hair growth and thickness, follicle size. So I can see it makes a lot of sense. I know why we use it topically, but it's no surprise that they're using it during the treatment and before the treatment as well. It makes a lot of sense.
Yeah. And they do and so just to talk about the PRP real quickly. So actually PRP, I'll go into the details in a moment, but is done up to 3 times. So it's a series of 3 injections in the scalp. And then it takes about 6 months for patients to see results, but could add in these peptides. So talk about so let's say I've done a PRP injection on a patient. We've gone through the series. They've done the pre-treatment with the thymosin alpha and then the thymosin beta-4. And then kind of talk about maintenance, like what could they do to maintain the growth that they get?
Sure. So, when it comes to hair loss, and we've been researching hair loss for a while, it's a very popular subject. And there's a lot of things out there. Everybody knows like minoxidil and finasteride, and there could be some negative consequences with using stuff like that, like rebound hair loss. Like it's something that you have to continuously take, or you'll instantaneously lose hair. And what's interesting is that when we were doing the research and looking at the studies, we found a lot of studies where they were comparing to, I would say the gold standard, or what used to be the gold standard, which was minoxidil. And we're finding there's a lot of newer compounds that were superior in some studies to minoxidil. And I actually was doing some of this research for a hair loss doctor that was doing not only hair loss treatments, but PRP as well. She came to us because she wanted to expand and she wanted to start helping patients with weight loss. And so she was asking me a couple questions, and we decided to do a project together and do some research. And I started researching all the different compounds and just kind of send her what the available research, what was out there clinically now. I sent to put together a document for her. But I decided to try everything myself because I was actually in the process of looking even for hair replacement. My hair was getting really thin. I had actually just given up on it. And I started utilizing all of it. And I was pretty surprised because I'm not going to lie. I thought treatments for hair loss was kind of like snake oil, to be honest with you. I just didn't think anything really worked. And I was wrong. I was so surprised when just after a few months, I had significant amount of hair growth. And that's when I started taking this, a lot more serious and putting more effort into it. And so some of the components that we had researched were a couple peptides and a couple other things. So specifically when it comes to peptides, the one that had some great research with it was PTD-DMB. And the way that this one was working was it was activating this new pathway that was discovered. It was a W&T pathway. And they found that this speeds up the rate of hair growth. And it created new hair follicles. What was interesting about this is that the study that they did was they compared PTD versus Minoxidil, and then they compared that versus PTD with Valproate. And they found that the combination of PTD and Valproate was superior to all of them. And so they look, and if you look at the mechanism in which Valproate works, it also uses this same W&T pathway that works synergistically. So that was a combination that we found to be, at least in the clinical studies, very beneficial. The other thing that we looked at was Latanoprost. And if you remember, back in the day, do you remember Latisse for the eyebrows?
Yeah.
So,
eyebrows and eyelashes. Yeah.
Right. For eyelashes. I'm sorry. And so Latanoprost is usually used for glaucoma, but it's the same mechanism of action. It's the same drug class. It's a prostaglandin. And so they did some studies with Latanoprost, and they found that it was able to recruit new hairs into the growth phase. And they also found that it was able to increase hair density. So this is something that we also utilize in the compounds with Valproate. And then the ones that are more commonly talked about now, peptide-wise, that people know about is one that you mentioned before is GHK-CU and zinc thymulin. And so what we saw with the GHK-CU that it was improving hair growth and thickness, it enlarged hair follicle size, and most importantly, it didn't have that rebound effect that you would see with Minoxidil. Now, the zinc thymulin, the way that was working, and the reason I'm going through all these different compounds is that I'm just showing how they're working on hair growth in different ways. Some of them are recruiting new hair follicles to the growth phase. Some of them are improving the density. Some of them are increasing the thickness. Some of them are improving the fact that they increase dermofibroblasts, which send signals for hair growth. So they're working in different ways, and that's the way that we combine everything into this protocol. And so, the problem is that okay, so you have all these compounds now. There isn't going to be any compliance. We can't be putting different drops into our hair, 4 or 5 times a day. It's not feasible, right? Because, when I was doing it, of course, I was testing it out. I was just taking everything all day long. But I was like, this isn't going to work for everybody. They're busy. They have things to do. They can't just be sitting around putting solutions in their hair all day. So what we did was we combined the GHK-CU and the zinc thymulin into a shampoo. And that was really important, not only because of the compounds that were involved, but because we found that with utilizing this with like a scalp exfoliator in the shower made a really big difference when it comes to buildup at the hair follicles. Like we have a scalp exfoliator that comes with the hair kit. And so that exfoliator helps remove buildup, damaged hair follicles, and things like that, because what they found was that hair follicles that were damaged or people that were having hair loss, they found out that those hair follicles are always deficient in 2 things, and they're deficient in zinc and in copper. So not only are we utilizing peptides that are improving hair growth, we're also getting copper and zinc to the follicle, and we're getting it in a way where we're clearing up any buildup that's around the hair follical.
That's amazing.
Yeah.
That's
yeah,
amazing.
It was just like sometimes things just work out. It's like you find out that they're deficient in zinc and copper, and at the same time we have the ability to use these peptides in that, at the right place, the right time.
I'm curious, how is the the Scalp Exfoliator different than the Derm Roller? So I'm just kind of curious.
So there's two things that we put in the kit. Put a Scalp Exfoliator and we put a Derma Roller. So the Scalp Exfoliator is what you're going to use in the shower. And when you're getting that GHK copper and the zinc thymulin, and you're using the Scalp Exfoliator. So the way that you use it is you apply the shampoo, and then you take the Scalp Exfoliator and you scrub back and forth just to open up the hair follicle and get any of that buildup that's happening there, and make sure that the medicated shampoo is actually getting in there. And then what you're going to do is just reapply a little bit, and you do it at the beginning of the shower because you want to have it on your hair, letting it sit there for at least 5 minutes. And so that's one way of doing it. And then the Derma Roller is something that we use after we use the PTD. And the Derma Roller, what it's going to do, it's going to increase blood flow that's necessary for hair growth. And you can probably speak to this as to how PRP is working and what you're doing when you're doing that in-office procedure. It might be a similar mechanism on how we're improving hair growth, because a lot of the times it's a blood flow issue. So not only are we improving a blood flow issue, but we're also helping get these medications or peptides actually into the scalp, which is very hard because it's obviously it's not very absorbable area of the body to get medications in. But this is one way that we can do that.
Yeah. So a lot of times with anything, like you said, it's usually a blood flow issue. Just before I go talk about that, I was just curious, and I'm wondering if the listeners and patients may be curious, is so our patients wash their hair with the specialized shampoo. They use the exfoliator, and then do they do the PTD-DMB with the Derm Roller after, like when the scalp is still wet? Like what's the process? So I'm just trying to make sure I understand.
Sure. Yeah. So the process is that you use the shampoo when you take a shower, whenever you happen to take a shower. The other part of the kit is all like your nighttime routine. It's not like it has to be at night. It seems to be just easier at night because it's the end of the day. You don't have to really worry about if you're styling your hair, or if you're doing anything like that. Yeah. So you use the shampoo whenever you take a shower, and then your nighttime routine, if that's what's more convenient, is that the PTD is a foam, right? And so you put the foam in the area that needs hair growth, and you just massage it in. And then that's when you use the Derma Roller. And so you're going to Derma Roller after you use the PTD, and then the Valproate and Latanoprost solution comes together in a solution. And so you're just going to apply the solution wherever you need to. And that's how we get all these compounds in at once, right? So you're getting GHK copper, you're getting zinc, you're using a scalp exfoliator, and that's all happening in the shower. Then we're also getting PTD peptide foam into the scalp. You're utilizing the Derma Roller. We're improving blood flow, and then we're getting that Valproate and Latanoprost to be absorbed better by applying that after. So we're hitting. I mean, I've never seen any other protocol that's hitting every single angle and every single peptide all in such a kind of easy to use fashion.
Yeah, it sounds amazing. And it's so nice because it all comes together in one package and is available for the patient to use. I'm just curious because it does say once daily at bedtime on a dry scalp. So for the Valproate solution. So can you use that one right after the PTD if it's a foam? Is that okay? Or should you do that one on a separate night?
No, you should do it together, because the studies where it was studied together was the PTD and Valproate together was superior to PTD by itself and was superior to Minoxidil. So we want to make sure that we're utilizing those together.
Okay, good. I wanted to make sure I understood, and I do recall that you said that. And then to go back on what you said about the blood supply, so it is true. So with the platelet-rich plasma, so often why it's so effective is because most of the things that we're trying to heal do not have a good blood supply. And so in our blood supply carries all those, growth factors that help us heal. So like when we take out the platelet-rich plasma and we put that in an area that's not healing, basically we're putting in all those growth factors that come in our blood supply that we're not getting. So we'll put those in there, and it allows the patient then to have the results of what you would have if you had a good blood supply to the area. So we usually do for those patients who don't know, so with platelet-rich plasma, what's so nice about it, it's your own blood. So you're not receiving anything outside of your body. We actually bring you in, we draw your blood. It's about 60 cc's. While you're relaxing, that blood is spinning to pull out those platelet-rich plasma. And then we actually take that. So there's platelet-rich plasma and there's platelet-poor plasma. And so the technique that I have learned is where we actually take the platelet-rich plasma and we put that into the scalp, kind of the crown of the head. Of course, we're going to work on areas that need more hair growth than others, but you really want to put it on you want to treat the whole scalp. You don't want to just treat the area that needs hair growth. So we actually bring you in for a series of 3 different injections, and we do them about 4 to 6 weeks apart. And what we'll do is we actually take that PRP that we've gotten from your own blood. So it's from your body. So there's no worry about rejection or contamination or anything like that, because we use a machine that there's just, once you put it in, it spins it, it pulls out the PRP, and actually then it comes in a specialized sterile syringe that is hooked onto the machine. So there's no having to transfer or do anything. And I use the word spun, but it's so much different than a centrifuge. I don't know if you've seen the Magellan machines, but they're like the cream of the crop. So they're so nice because they actually pull it out and they put it in a syringe. And then we use that to put back into the scalp. And you can, like I said earlier, use the thymosin beta and actually use peptides then in with that when you're doing those injections. And then we also do some microneedling at the same time that we're doing the PRP. So kind of similar to, not quite the same, but like your Derma Roller. So it allows us to really get that in there. And also that's where we use the platelet-poor plasma. So not only do we inject the PRP into the scalp, but then once we're done, we put on the platelet-poor plasma, and it kind of almost think of it as sealing up the holes where the injections were. And then we also use the microneedling at that time, just before that. So we do the microneedling, and then we put the platelet-poor plasma on there, kind of seal it all in, and then to help with hair growth. So kind of a complete package then that we could offer the patients.
Yeah, I felt like that was a lot. If I was a patient listening to this, I'd be like, wow, what is all that? I mean, it's a lot to digest, you're doing a lot in that in-office treatment. And I think it's a shame to go and do something like that and invest in something like that and spend some money, because, the PRP is not cheap for anybody, and that's definitely not cheap for the physician, and then not have like an at-home, maintenance program to go along with it. So it's great that you're doing this together, but it is a lot. There's a lot that goes into hair growth. It's more than buying, Minoxidil at the grocery store that's been sitting on the shelf in a warehouse that's, got a low concentration of Minoxidil in there. There's a lot more that goes into it.
Right. And I think it's frustrating for the patients because they do buy it and they do try it. And then when they don't get the result, they get very frustrated. So I think one of the take home messages is that to grow hair, it doesn't take just buying something off the shelf and thinking it's going to work. Like, these are protocols that you've researched that we know work. And what's really nice is I've actually shared these protocols with my patients, and you've done such a beautiful job of, you have all the references there as well. And so I show them, like, this is based on research. This isn't just something we threw together and we're hoping it's going to work. Like, this is based on research, and then being able to add the procedure to that on top of it is really nice. I wanted to say one other thing too that is really important for listeners and patients to know, is that there are side effects with things that you buy off the shelf. Because I had a patient actually I just saw recently, someone I know really well, and she bought a product to help her with hair growth because she was concerned. She's going to be 50 this year and her hair is really thinning out. And there's iron in this particular product that she purchased. And so when we ran her labs, she had excessive iron overload. And so much so that it was affecting her liver numbers, and had no clue whatsoever that, by buying this product and using it to help with hair growth, that she was actually getting too much iron. And because a lot of times patients who aren't growing hair, one of the things could be, is that they have low iron. And so she was actually depositing all this iron in her liver, and then her liver numbers were way off. And then she had inflammation. So her inflammation markers were up, and all of this just because she thought she was doing something good for herself.
Was it like a multivitamin for her hair growth that she was taking?
No, well, it did have some vitamins in it, but no, it had like iron in it. It had some vitamins in it. It was just
it was oral? It was a capsule?
Yes, it was oral.
Oh,
yep.
Okay. Yeah, because there's a lot of hair growth stuff out there where if you look at the ingredients, and as a pharmacist, is something I always look at is a lot of these things, they're just putting a bunch of vitamins in there. And I understand why they're doing it. They're not, it's not unintentional, because it's like we said, hair growth is a full approach. It's being, not being vitamin deficient. It has a lot to do with your diet. It has a lot to do with a lot of things, your immune system. So they're trying to create a multivitamin that can help on the insides when it comes to hair growth. And that's important. But what they don't realize is that every supplement out there is also putting those same vitamins in there. So that person might be taking a daily multivitamin. They might be taking something for their hair. They might be taking something for their nails, something for energy. And they all have a bunch of vitamins in there. And so you can be overdosing on this iron. I've seen it happen a bunch of times. So yeah, it's a really important point.
Yeah. And I see it happen too. And that's why I always say to patients, it's always so important to find the root cause of the problem. So, and by finding the root cause also means eliminating causes or potential reasons. So I say to my patients who complain about hair loss, I tell them, okay, so we want to check your iron. Is it the fact that you don't have iron? Is it the fact that you're stressed? Is your cortisol level through the roof? And that's why you're losing your hair. Is it the fact that you might not have zinc? So I do check a zinc level. So I always am looking for what is the cause of your hair loss. And then when we rule things out, that's when, okay, well, we've ruled out the things that we can fix internally or things that we need to supplement with. So therefore, then do we need now to look at, okay, do we need to do a protocol like PRP? So it's so important that you are working with the practitioner, and then also too working with the pharmacist and making sure that we're putting together something that your body actually needs and not just guessing. And so often I see that, patients come in and they're guessing, okay, I'm losing my hair. Well, and also too, as I look at their hormones, like, is it my hormones? Is it the fact that I need, they're not able to dive deep like that. And so I think it's so important. I said to my patient, I was like, I understand that you're trying to help yourself and that's great, but everything that we do has an effect, and then it has a side effect that you may not know. And it's so important that we're looking at everything. And so we always do lab work on all of our patients who are losing hair to figure out what is the root cause and then what is the appropriate treatment. And then we just happen to find out.
That's great. That's so important, because nowadays, hair loss is a big topic. It's a big moneymaker for a lot of companies out there. And unfortunately, you can go online and click a couple buttons and get sold something very similar. Like if you go online right now, there's so many internet pharmacies and internet companies that are selling you some, biotin gummies, some basically Rogaine or Minoxidil off the shelf, and some, finasteride, and you can click a couple buttons and it'll be at your doorstep. And they're not looking at any of the things that you just talked about. And that's why the things that you're doing are so important. It's such a higher quality, a higher level of care when you're looking at all these things when it comes to something like hair loss. Because just like you said, it could be hormones, it can be deficiencies, there can be so many things going on. So that's why, something like hair loss seems simple. Oh, let me just get this vitamin over the counter. Let me just go get this thing on the shelf. But there's so much more going on. And it's not only hair loss. It's things like, sexual health. It's not just, oh, sexual health is declining, let me go take a pill. No, there can be a lot of other things. These are all signs of other things that can be going on. That's why it's so important for someone to see someone like you to take a real close look at everything that's going on, because it could be signs of other potential problems.
Exactly. And also too, like when you just mentioned sexual health, like I have the conversation with my patients every time is that, has anyone looked at your cholesterol level? Like, it's plumbing. Like, let's make sure that the plumbing's working too. Like, let's make sure that, everything can get to where it needs to go. And if you have plaques in part of your arteries, you're going to have plaques everywhere. So, so then it opens up the discussion about diet and exercise and what's going on with their cholesterol level. And yeah, so it's just so important to take a whole person approach. So this podcast is about hair loss, but we want you to remember that it's not usually just one thing. And so we want to always look at the person, look at our patients, and look at them holistically, like what else is going on, and make sure that we're optimizing everything. And bottom line is that we're looking at the root cause of the problem. So I think that's the biggest thing, because if we can find out what the root cause is and treat it, then they'll get a great outcome, and we won't cause I always say I don't want to cause a problem while I'm trying to fix a problem. So it's so important not to do that. And that's why we want to look at everything. So I love this protocol. I love the pre-treatment. I love the maintenance part of it. I think it's going to be great for my patients and listeners to help them to, a lot of us, we identify with our hair, like especially women. Like it's just such a big thing, but I'm sure men do too. Like it's such a big part of who we are. Yeah, who we are.
It is.
Yeah. So thank you for sharing these with me and with the listeners and with my patients. And if you want more information, you can go to our website. We'll definitely have a spot there that will provide more information. You can listen to the podcast. You can contact the office, and all of that will be available in the show notes. So Leonard, again, I can't thank you enough for just sharing the wealth of information that you have. We're so lucky to have you. And I can't wait till we get back together again and talk about another topic. So I learned something, the listeners learned something, the patients
and I'm definitely
do.
learning things. The way that you talk about how you're working with your patients, I pick up so many tips and tricks to help other people just talking to you on the podcast. So it's awesome.
Well, thank you. It's a win-win. And then I always like it when it's that way. We all win. We all do. So thank you for your time today. And until next time, thank you so much. I really appreciate it.
Okay, thanks.
Thank you for listening. Please remember, this podcast is for educational purposes only. It is not a diagnosis nor a prescription for care. If you are interested in learning more, please go to wisconsinfunctionalmed.com. All one word, wisconsinfunctionalmed.com. Until next time, live well and change the way you age.